The North-West Zonal Office of the National Agency for the Control of AIDS, NACA, in Kano State is one of 6 across the country, born out of the need to decentralize the agency's activities and bring various HIV interventions closer to the grassroots. Hello there, I am Adesua Osuyi, and this is The Last Mile with NACA. This episode highlights efforts of the NACA North-West Zonal Office across the state in its jurisdiction and the HIV response in its host state, Kano, led by the state's Agency for the Control of AIDS, KSACA. Don't go away.
Section 6, Subsection 2H of the National Agency for the Control of HIV and AIDS Act of 2006 provides for the establishment of zonal offices to coordinate the agency's functions. However, this was only recently achieved by the President Muhammadu Buhari-led administration. The NACA North-West Zonal Office was commissioned in January of 2020 and oversees 7 states including Jigawa, Katsina, Kaduna, Kebbi, Sokoto, Zamfara and Kano States.
Zonal offices is meant to decentralize the activities of the HQ. All the mandate of NACA is to be brought down at the zonal level, overseeing the states. Now, what do I mean? The zonal office is to be the hub for the activities of the HIV response at the sub-national level. One of the things is that we have to plan and coordinate all the HIV activities in the states under our purview. 2, we also to make sure we advocate for mainstreaming of the HIV in all sectors, taking to cognizance and carrying along all the stakeholders that are involved in HIV AIDS response in the country. 3, we also to evaluate and monitor the activities as far as HIV/AIDS response is concerned within my zone and come up with programs and policies. We also mobilize resources. We facilitate the engagement of all the stakeholders, both at the state and the local government, and mobilize. So we also advocate to all stakeholders and the policymakers to make sure enough resources are appropriated, and not only appropriated but released for them to perform their function in the as far as HIV response is concerned within the clauses of state within the zone. Another mandate of establishing is that we are to move closer to the state to oversight their function and provide technical support in all areas of the response, so that the state will own the response and be at the driver's seat to drive it, as we are aiming towards epidemic control. After the control, that control has to be sustained, and it is the state where the things are really happening at the local level that has to be at the driver's seat, so that they will continue after the donors might have left, so that we sustain the response. So by the year 2030, our 95% UNAIDS target become a thing of reality, even before then.
The North-West Zonal Office is located in Kano State and works closely with the state's Agency for the Control of AIDS, KSACA.
The relationship as it is now, it's more of NACA doing most of the engagements and then discussing with us on guidelines on or how to go about with the response whenever there is any visit or any engagement. As I said, the NACA usually comes around and then we look at how those things can be done together. But we would love that to be better than that. We would love that to be more engaging, more participatory, because most of the times we try to draw attention that looking at states, they might have so many different peculiarities which need to be captured most of the times at the beginning. So I think that is one area that we need to do better, both of us.
The Kano State government, through KSACA, does a lot, especially in the area of awareness creation.
In terms of demand creation and awareness, demand for the services and awareness that this is actually a disease that exists, that you need to do this and that. We actually do a lot in terms of providing information through the print media, through the radio and television. We actually inform the general public that this is what you need to do to prevent yourself. This is what you need to do when you feel like there is need for you to visit a clinic. You can go. These clinics are very available, and we have 43 comprehensive centers and a lot of other diagnostic centers, over 600, where you can get diagnosed. So, and they link you up to these comprehensive centers. So we do that a lot. And not just that, we look at our peculiarities. Those that actually look at the TV, they listen to the radio or read the newspapers are actually few. The majority are those living in the rural areas. And what we did was to link up with the community leaders, both the religious leaders and also the community structures, the leadership, the Mayongwa, that is the village head, up to the level of the Hakimi, that is the district head, and also our 5 first-class emirs who have actually assisted us in passing this information into their communities. We have engaged them so much that they are now very conversant with what is HIV/AIDS, how do you contact the disease, how do you get treatment, and how to prevent others, and also how to take care of those babies and to prevent so many other things.
Dr. Sabitu also highlighted what the state is doing with regard to prevention of mother-to-child transmission.
And we also look at the issue of PMTCT, which in the communities, we actually look at those community areas where people give birth. You see, if you look at our ANC data, you see that the level of attendance is quite good, but at delivery, you see that most of the deliveries are at home. That is cultural. And so we link up with these traditional birth attendants and other key people in the community to ensure that these women get tested, even if they didn't come to the facilities, because people now ask, where have you been tested for this? Have you been tested for HIV? And that has also gone far to even the level of premarital screening. In Kano State, premarital screening is quite important to the extent that our imams don't solemnize weddings now without seeing evidence that you have been tested in a facility. They actually encourage. They said, okay, if you are coming, make sure you go and meet the healthcare workers, let them do the right thing, okay, and let them tell us that you have been screened. Not just HIV, so many others.
Some states, including Kano, are yet to adopt the Anti-Discrimination Act of 2014.
Most time when you move out, we advocate to our authority through the state SACAs. They take the lead, we follow them because they own the state and they know where the powers are. So in North-West, at least states like Kebbi, Sokoto, Katsina has domesticated some of our policies, especially this 2014 anti-discrimination law. They've domesticated at the state level. But Kano now, we have not been able to do that because of some constraints. But meanwhile, we are still on it. So that when we are done, we now present it to the state assembly to work on it and domesticate the act. So that the issue of discrimination, which is one of the barriers, confronting the response, will be a thing of the past.
In our own efforts, we look at the key population. We said instead of having just a clinic and calling it one-stop shop for key population, why don't we look at other clinics where they can also attend? By that, you don't provide one space where it will be a form of discrimination. Whoever sees you going to one-stop shop knows that you are actually this or that. So, and in terms of the law, since 2014, some few years later, the state assembly has actually received that, and they are still working on it to have that law, because you have to look at the state peculiarities, which we are currently looking at that together with the state assembly to see how that will be domesticated and it will have the effect that we want it to have in the state.
Traditional and religious beliefs are still a bottleneck to the HIV response in the region, as in most parts of the country.
The issue of getting people to understand what the response really stands for, especially the identification of, in one of the research done, this mode of transmission, the research report came out that the unmarried young people, as the AYP, these adult and young adolescents, and the key population are one of the major drivers of HIV. So most of our programs is being focused to make sure services are accessible and available at no cost to this group of people, the AYP and the key population. When by key population are men having sex with men, the sex workers, the people who inject drugs, the transgenders, the people in closed settings like the prisons and the remand homes. That report came out that they were drivers constituting more to new infection. So we focus them. But the barrier is that, especially on the KP, most of the states within my region, some of them fail to understand the context and the content of that program. They were thinking we were trying to promote a kind of, they are looking at on a religious angle, not looking at the medical and the structural angle. What we're trying to do is that we want them to have access, not to discriminate against them, to have access to treatment and prevention services. If that is done, the level of new infection will come down drastically. But we have been able to go out a kind of sensitization and awareness to make sure we buy them in to be part of that focus, so that challenge will be off in the near future.
For Nigeria to attain HIV epidemic control and sustain it, there is need for the states to play more active roles in the national response.
I want to praise the federal government under the leadership of President Muhammadu Buhari. He has been doing well, to the best of my knowledge, as far as HIV response. He has volunteered to be given certain percentage of money every year to make sure the response. And since he came on board, honestly, we have gotten government funding more than it was before. So on that note, I'm commending him for doing that. So on the part of state, I'm now appealing to the state not to depend on federal or donors. Because what we are looking at is epidemic control and sustainability. And as I've said earlier, if we are moving towards epidemic control because we are doing fine under our DG, Dr. Gambo Aliyu, we are doing very well. So when you get to that point, the donor will automatically divert their attention to another thing, since you have gotten into epidemic control. But that epidemic control is not the last thing. We have to sustain it. And who are those to sustain it? It is the state. So I'm appealing to the state government and the executive especially, because at one of the meetings in Abuja, all the state governors promised that 0.5 to 0.1% of their budget will be a mark for HIV response throughout the country. But up to today, they have not fulfilled that pledge. So I'm appealing to the state government, not even within my zone, all the state governors, to please fulfill their pledge of 0.5 to 1% of their budget being allotted, not only appropriated but released for the HIV response, so that we'll be able to sustain the response after the donors and other guys that matter for withdrawing their funding.
The task of the NACA Zonal Offices is indeed not an easy one, as states have their peculiarities. But with continuous stakeholder engagement and advocacy, a lot is possible. According to the Director General of NACA, Dr. Gambo Aliyu, the zonal offices will help close the already identified gaps in the intervention and set Nigeria well on the path to HIV epidemic control before the year 2030.
What we want people to know is that there is an act against HIV stigma and discrimination. And the act has two components. There is the jail component, there is the fine component of it. So it can be both, actually, depending on the gravity. People with HIV live normal life. They work as productive as any member of the community. And among them are intelligent people, hardworking people. Why should we discriminate against them? If we stigmatize people and we discriminate, it puts them away from our hospitals. It prevents them from coming to our facility to know their status. It prevents them from coming to our facilities to take these medications that are very helpful. So stigma is a number one enemy for us in fighting HIV disease and in controlling HIV disease. And we will be all out against it.
For Nigeria to attain HIV epidemic control and sustain it, there is need for the state to play more active roles in the national response. Update segment is next. Keep watching.
A delegation from the Abidjan-Lagos Corridor Organization, ALCO, based in Cotonou, Benin Republic, were recently in NACA on a working visit. In his remarks, the Executive Secretary of ALCO, Dr. Idrissa Kone, stated that findings from a recent study among the fishing communities along the corridor threatens to erode the gains made so far.
ALCO is the Abidjan-Lagos Corridor Organization. It is an intergovernmental organization that work on prevention of HIV among mobile population, as well as improving free movement of goods and persons along the corridor from Lagos to Abidjan. You may know that all the 5 countries have done a good job in controlling HIV, but we found out that the one target is a bit left out at the fisher folks, and we were able to conduct a IBBS survey. We hope that the results are relevant and will enable countries to revise their strategic plan.
A presentation on the HIV surveillance survey among the fishing communities along the Abidjan-Lagos corridor was presented by the national consultant for the project.
The objectives of the study was to contribute to a better understanding of the HIV epidemic amongst fishing communities along the corridor. We have also key specific objectives, which is to determine the HIV and STI prevalence amongst fishermen community, to assess knowledge, attitudes, behaviors, and practices related to HIV and STIs, to assess knowledge, attitudes, practices related to the use of SRH services, to also identify risk factors for HIV infections amongst these populations. So for Nigeria, we had a total of 511, 50.7% female, 49.3% male. For those who had accurate knowledge here looks at someone who is healthy, who has HIV. The other one is being able to protect oneself by having sex with an infected person who is faithful to the respondent. And the third is protecting one by using a condom correctly. So looking at this specific to Nigeria, we have 68.1% and 74% respectively. So looking at access to HIV testing, ARVs and viral loads per country, for those who had ever been tested for HIV in Nigeria, 35.2% of the respondents. So therefore, the current prevalence rate we have now is 1.6% for Nigeria. The results of this study confirm that the fisher folk community is vulnerable, and there's a need for the countries, in this case Nigeria, to pay special attention to this population. The exposure to HIV amongst the fisher folk community is a concern and require planning, and they need to strengthen plan interventions for this subpopulation.
Questions were asked, which were duly answered by the ALCO team, and contributions made by the Nigerian party present.
I want to say it's a very good study. We have had some, maybe not a structured study like is presented today, but actually this show, or rather suggest that fishing communities actually have maybe higher risk or even prevalence of HIV. So I'm happy this study has actually brought it out very good. And I also want to commend one of the recommendations. So we're not even just going to limit looking at the people along the corridor, but different fishing communities. Okay, we have in our country to see how we can really do both prevention and treatment and services for those communities. One thing that came out clear is that their prevalence is certainly above what is our average for the country.
In one of your challenges, which is fear of stigma, for them to be able to attend to certain questions, I think if NEPON is aware, you can collaborate with us. We have state office in Lagos. We have our state office in Lagos, and we have a lot of support groups. It will also help you to deal with that, working with NEPON at the state, Lagos State, to actually get these people and properly work with them for that.
Studies such as the HIV surveillance survey among the fishing communities along the Abidjan-Lagos corridor are crucial for member countries to stay on track with the global target of ending HIV by the year 2030.
We all know festive period is a time to loosen up. We all have fun, lots of hangouts.
However, statistics show increased indiscriminate sexual activities over the holiday period.
Unfortunately, this also means more people are getting sexually transmitted infections.
One gift I will never love to get during this festive season is that of HIV infection.
So, celebrate this holiday responsibly and with caution.
Avoid anything that can lead to new infections, impacting the progress made in the fight against HIV and AIDS.
Your New Year resolution should include knowing your HIV status.
Get tested for free today.
Bruv, babe, share love and not HIV infection.
They go like this now. Take am easy now.
Now hospital I dey go to do HIV test.
Now everything you dey do HIV test. Before you carry belle, you do HIV test. Now you dey rush go do another HIV test. Wetin you dey find, you go see am o.
No be so, my sister. HIV test no be bad thing o. Now make I know my status so that no matter the result, my pikin no go get HIV.
HIV fit pass from mama to pikin?
Yes o. During pregnancy or labor, or even when we dey breastfeed the pikin. Yes, and my husband dey road dey come sef, he go meet me for hospital. We go do the test together.
Hey, your husband na man he be. But wait o, una no dey fear. What if the result come out positive?
Fear wetin na? HIV no be death sentence. And medicine don dey to take manage am. See, nowadays people wey get HIV, they live their life normal like everybody else.
You sure say I no go follow you go do my own so?
Wetin you dey wait for now? Come make we go jare. With quick action, we fit stop this HIV waka from mama to pikin. Go do your own HIV test today.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. Thanks for watching. Please follow us on our social media platforms at NACA Nigeria and subscribe to NACA TV on YouTube for more. As always, support the HIV response. Do not stigmatize or discriminate people living with HIV. Avoid indiscriminate sex. And lastly, know your status and take action. Till next week on The Last Mile with NACA, I am Adesuwa Osui. Goodbye.